got it there, or a word view. Okay. Next. I don't know whether you can see I'm sure you can see this. This is system engineering and the safer word is system thinking applied to safety. So this is nothing new. It's a lots of idea of the system thinking going on, and I was trying to, even system thinking has been applied to physician burnout and things like that. So I was trying to find that paper from National Academy of Press, but I couldn't find it, and that was for the benefit of Lisa. So many publications going on in healthcare organizations and talking about system thinking, to bring the system thinking in organizations for a better understanding of the individual, helping people morale, and then increasing their productivity in the end. And in the recent year, last 10 years, or maybe just less than 10 years, institutes of medicine had a working group, and then they had a workshop, and then they come up with towards a science of learning systems, a research agenda for the higher function of learning health system. What do you think a learning health system is? So why the science of learning systems? As we said, we've been doing health system we had the health system for over 100 years, and we've learned, we experienced a lot. And what is it that we didn't get it right?
Hi, so a learning health system is a system that continuously learns iteratively through cycles of information, data, experiences, a variety of sources. But there are many definitions to it, but that's one that
that's the one it is. Exactly.
Yeah.
Exactly. I thought you would say something there. So I mean, why is it they all of a sudden they decided that, okay, we're not doing right, we're not doing this correctly, because we're not learning from our mistake, we are not pushing our good side, the things that is good, working well, we're not, all of these things been mentioned by people like Dylan, by Andre, Elizabeth, and many other people, myself and Amanda, Lisa, and you all could start, but it doesn't. They all become as just goes in a deep black hole and disappears, because so idea of the learning health system. So the reason I put this one on, because I just wanted to emphasize systems, considering things as a systems. As Amanda just alluded to, this is coming from the same publications in Institute of Medicine, and these publications, by the way, most of it, if you go to IOM, is mostly free, and you can download quite a lot of these workshops has been done as a publication. So here is saying that this design in this case is coming to a specific, and I haven't shown the actual system engineering model of the learning health system. This is more specific. If you have a specific problem of interest, like let's say you want to eradicate or reduce the prevalence of asthma, or you want to reduce prevalence of diabetes in Vancouver Island. So that is the type of thing. So decide what the study you want to do, specify the data you need, assemble the data, analyze, and then interpret the result, represent the knowledge, and formulate and deliver and tailored messages to the workforce. and then take action to the change practices. And then, so this interpretation of the result could be become knowledge. It could be a good practices, could be a bad practices, could be a adjustment to specific things. Yeah, you will say that this is my data science. Everybody could call that as a data. Everything now is data science. So that is another example that we need a new methodology, technique, and tool to effectively bring the learning health system to realization. So in this case, so idea of the feedback loop is I just wanted to bring you to the idea of the feedback as circular. It's been around for years. You do it every day at home, and the idea of feedback is about a sort of a control policy. So you have information systems that it will tell you to adjust the turning of the hand to either have a less water or more water coming in. So this is a very simplest form of the control systems that you can do. So your brain is a controller through the eye and control the policies in this case, and the adjustment of the water flow of the water coming to it. So here, when you see the eyes will see the level of water and then adjust the going back. So now every time now you're going to drink the water and then you'll think it twice. So there we go. Okay. There's is another example of the systems thinking is when an insect is eating a crop, the conventional response is to spray the crop with this pesticides designed to kill that insect. Putting aside the limited effectiveness of some of pesticides and the water and the soil pollution they can cause, imagining a perfect pesticide that kills all of the insect against which it is used and which has no side effect on air, water, or soil. Is using this pesticide likely to make the farmer or company whose crop are being eaten better off? So that's the questions, but this idea of the pesticides is something that you create something, you're solving a specific problem and then creating some other problem. And so if you have a problem like this, it's described in English, you can depict that or visualize it in a form of what we call a causal loop. Loop, by the definition of the loop, you start from one point when we end on the same point. That means that you have a loop. Let's say we have a number of insects in a damaging crop. We start with and then going in the same direction and coming back, so we have a loop. But these loops have got a different sign in this case. There's some are an opposite sign and some in the same sign. Some of them is increasing, and therefore, if number of the insect increases, so there's the same sign. And so this is a view of insect problem. I think that's self-explanatory. You can easy enough to understand. The idea is total number of insect damaging crop increases. Your pesticides application increases. If the pesticides application increases, the number of the insect decreases. If the number of the insect decreases, the number of insect B will increase. If number of insect B increases, then number of insect B damaging crop will increase. And if that increases, then number of insect is in and the number of the insect damaging crop will increases. Again, this is the same sign. We're going around the loops and so on. Okay, so this is maybe I mean, you starting you have a few elements or variables, what you want to call it, and you're interconnected, that you have a purpose attached to it. You have a model, a simplest model. So before we start doing modeling and show modeling, just and I've seen from most of you are applying model in your in your posters mostly, and use a lot of model and modeling techniques. And I can tell you, look at George E.P. Box. Box and Jenkins are both very engineering systems people, time series analysis, and the greatest statisticians. And one of his saying is, he said, essentially all models are wrong. That was first he said that, but eventually, through the year, they sort of completed sentence, but some are useful. So I think we bear that in mind when we are going through these modeling techniques and form. So I'm just going to show you some example of these type of modeling. So again, looking at these things from the system perspective, idea of this type of modeling is not only you include tangible variables, you can include intangible variable as well. So you can include morale of workforce, satisfactions of patients, if you like, or doctors, and so on and so forth, into your model. How do you measure satisfaction? Ask your social scientists, or morale of workforce. You can. So these things are nowadays qualitative techniques are so advanced that you can measure to quite degree of confidence with your value of the parameters. So again, the systemic view of the EHR problem adoptions, so a group of the people in US tried to, because we had a lot of, especially in the US, you had a lot of adoption problem and so on. So they tried to model it, and then the cause, what causes of adoptions and non-adoptions are all included within some links in here. And these causal links are interconnected as a model. Oops, I don't know where we go. Here we go. So there, as a model in here. So you have not yet adopted populations and then adopted population. So actually, originally in a basic form, that if you want to model something that so I just have to explain a little bit more here. This is in systems dynamic. This is considered as what we call stock or a bucket. In the bucket, you accumulate things. Yeah, you count. So now you have two stocks, two buckets. One bucket potential adopters, and one bucket are actually adopted the system adopters. So there is a changes. If this potential adopter reduces, the adopters increases. So there is a rate. There's a control. There is a policy decisions, if you want to call it, that changes that. And one is stock from one bucket, take the people from one bucket and put it up. So in fact, and for those, I'm sure there are plenty of these clever boys in a classroom telling me, oh, this is a simple differential equations. You are absolutely right. Very simple differential equation. You're saying rate of change of the adopters from one to the other is over time is a different differential equation. So, and is dependent on these parameters, for example. Okay, so here is this simple model. Is these guys have applied it to EHR adoption, and then of course the effect, the number of the parameters that involved is different to what a simple model shows before. So cultural barrier. I mean, some of the things I could look at these cultural barriers, providing incentive for adoption, for example, providing revenue. These are all the variables that could affect adoptions of the EHR. Is lack of a standard in the EHR was maybe one of these things. Market maturities, quite a lot. So the purpose is, there's two things. What I was trying to say here, look, so you can see is that you have a different parameters within these systems. And then if you look at my previous adoption and non-adopted systems, it's quite small, but you can utilize that and expand it to what problem you have. You can apply this to many different things, but just creating the parameters, but knowing then where you can get these values for these parameters. These doesn't come by, you can't have. So maybe incentive would be is a good example. That maybe that government would say we give you $10,000 if you utilize EHR, but some of these things market maturity, what is that? So you have to have some data, some sort of you have to have the sources, a risk of purchasing product obsolete in the future. I mean, these are very obscure type of variables, but you have to have some value to go through the simulation or to run the systems there. But this is one example of system dynamics sort of modeling, and as I said, this is a stock and this is rate, which changes the stock or your bucket from flow of water from one to the next, or flow of the people from it. These buckets are changes. In fact, this is like this bucket is a curve, keep changing, either increasing or decreasing or oscillating, depending on how this decision maker, the rate, is affecting that bucket. So again, this is called systems behavior. So you have an oscillatory behavior. You may have, while we're talking about bad behavior like Abdul, so you can have a sort of this type of behavior. You can get a system that when you're introducing new system to the hospital, and in fact, this is the other one. This is opposite. When you're introducing a system to your hospital, the people may not like it in the beginning, but through more learning, that likiness will increase. So you have an exponential growth. But sometimes you choose systems like iPad or iPod or Apple, for example, producing these new computers. There's a huge surge, but these people have to be able to sustain this surge. If the company can sustain it, keep people happy, then fine. But if they can't, they will collapse. So you can see is a overshot and then collapse system could coming up. Some companies cannot do, even though they have a good systems in place, they can't compete. So yeah, we talked about oscillatory system. You have a chaotic type of system. So there are many different type, or you have a S-shaped type system. You're gradually increasing, and then you reach a threshold that then you control on that threshold. So, and you have a decaying system behavior. So there's many different behavior of the system. So, okay. And I think this is quite an old one. Again, you can try to show it to you that you can apply it to anything. This is about, you know, creating, showing the whether you know, problem with the medication, medication process, and whether you can introduce intervention to reduce some of the errors in the medication process. This is the old paper. So causal diagram consists of variable connected by arrows denoting the causal influences among the variables. The important feedback loops are also identified in the diagram. Variables are related by causal link, shown by arrows in the example. The birth rate is determined by both population and the fractional birth, for example. Each causal link is assigned a polarity, either positive or negative. And we said, so these polarities, if you have an increase in one and increase in the other one, this has got the same polarity. So if you have a decrease in one and stupid mouse misbehaving. Decreasing one, you still have the same polarity going the same direction. So you have a positive. That's the only time a lot of people make mistake when they're seeing about the sign of the causality. So here is you have a different polarity. When you is, I wish I could slap the computer, but I couldn't. They have here you got the sign going up, and then the other side, the cause have the opposite effect. Causality got a different effect, different polarity. So it's got a different sign. So that's what all these negative and positive indication are. Okay. Yeah. So we also introduce a dependent and independent variables here. A positive link means that if the cause increases, the effect increases above what it would otherwise have been. And this is the language of system, by the way. This is the way we want to describe. Idea of the system, you need to say it in English, be able to describe it in English. And that's the beauty of the system dynamic and causality. And if the cause decreases, the effect decreases below what it would otherwise have been. Again, it is negative link means that if the cause increases, the effect decreases below what would otherwise have been. And if the cause decreases and the effect increases above what it would otherwise have been. So there's both of them. So my negative and positive. So this one, what it says is one goes that way, one comes down this way, or if it goes that way, one goes that way, and this one goes that way. It's exactly the same thing, slightly different directions. So, and here this is taken from John Stearman's book, System Thinking and Modeling for a Complex World, Business Dynamics. It's one of the best book in old book, but the best book in system dynamics, but mostly business idea. So the symbols is shown there, but just to show you a little bit of it to those engineers and statisticians in the world, it's not just the link and idea of this idea of the system dynamics came from a very brilliant guy called Professor Forrester from MIT, who was on control engineers in World War II, and And after that, he got he stayed in MIT one of the MIT lab. He was one of the inventors of, I think, random access memory in old computer systems, if you like. And so they sold that one to IBM, and he got lots of money. So he wanted to stay academic after that. But what he found out that, when he was working on these control problem, control engineer, remember the feedback I showed you, the learning health system I showed you, is a control system, is cybernetic type of systems. So he thought it was too rigid to, he wanted to apply it to organization with the softer variables and so on. So he came back, and then he started this system dynamic methodology or developments in MIT, and actually two of the systems that you see at the moment in the market is both coming from his lab, and so telling you that story is that behind all this modeling is mathematics. So as I said, there are differential or partial differential equations, and it is a curve because you can see there is integrations going on. Integration is the curve. You're trying to find area under the curve, accumulation under the curve. So quite reasonably, it's simple. And most of these systems, again, this is for benefits of in those engineers. They use, of course, all of them use numerical solutions, and numerical solutions are either Euler methods or Runge-Kutta methods that we can bring a numerical solution for some of these integration differential equations. Okay, so idea of it anyway. I'll show these steps, the way these things work in a more easier way in a minute or two. Even though I've been talking about a model and causal model, I thought I'm sure you all know what the definition of the mathematical model is what we're coming from the real world or real system phenomena, and where you want to go to mathematical operational world. So trying to find some sort of a mapping between them. So from the real problem, we have this modeling process. I thought better, it's a habit to tell you that from real world, by formulation, you formulate a construct of it, and you become a model. You do the analysis, and by creating a model, and then you identifying the model by calculating the parameter. That parameter estimations is, of course, you need the statistics and data, and then you have a model and you can do the analysis or some sort of a conclusion from these analysis, and then what do you use it for? When you could use it for description, predictions. So most of you doing a lot of predictive modeling at the moment. So as I said, most of the model are wrong, but some useful. Some of these predictions are useful, some not. But descriptions, I think, understanding of the problem better. I think that explaining something. And one of the paper I suggested for you to read was about a policy analysis in terms of evidence-based in public health, and that is very powerful to show. The whole idea of the Forrester was just to convince the management and CIO, CEO that these things is that's what happens if you do this decision. This if you do this will happen. The scenario building on these things. So that is give the real world give some real world problems. Sufficient data is gathered to formulate model, and analysis of the model yields certain mathematical conclusion. This conclusion, and interpreted with respect to model purpose, description, predictions, and explanation. Finally, test interpreted mathematical conclusion and analysis formulated from real world. I'm doing quite a speed reading because I'm not even halfway, but I'm getting, if necessary, iterate and refine of the model, because I know most of you know these things. I think it's also, most of you know it, it's good to remember. It's like most of the software engineers know how to do the developed system, but when they go to do the requirement analysis, they forget the basic ideas. Ask people from CERN. So system technique, it could be technical, clinical, managerial, organizational. So the system approach could be all of these, could involve all of these. So from the systems, we want to get to the model. So there's a modeling methodology with a purpose. And, you know, within modeling methodology, it tells you that, you know, you need to formulate things, you need to identify parameters, you need to estimate the parameters, and then do the realization by solving the equations and so on. And then do the interpretations of the data, test and validate. If they're good, then you have, you know, your model is working, could become theories or law, and so on and so forth. So from system to the model, and this is a very basic feedback model. We've seen a couple of these before, and this is a very simple. You know, you patient and the clinical decision maker could be clinician interactions. Clinicians advise the patients, make a decision, advise the patients, and then patient carries out. And then, you know, those informations that coming from the patients goes back to the clinician and just adjusts itself and so on. This is a simplified idea, is having a IT systems and within our clinical systems setting, and all these informations and data are seamlessly going to, that's a utopian idea, but so I'm going to show you, I talked about control systems or feedback system. This has come from the science of cybernetics, is a science of human and machine interactions, if you like. So the idea is, there's a control units that which controls the whole activities within the units, and then you have something that you need to process it, and then you also have information systems within your. By the idea of the information system, in a human could be I, if you're driving a car, for example, you see obstacles, you brake, and that is, your brain activating your muscles of your foot to have a brake. So that is, again, you have a desired state. You want, you want to achieve that. When you get there, and then if it's not actually is, what you require, the information will give feedback to. Give the feedback to the control units, and then they do the process again. So it's a closed loop control in effect. But there are environmental disturbances from around here, so that could happen. So this is a basic cybernetic model, and then you can utilize this. You can utilize this and put in for a control unit. Could be, a chief executive of some places who in charge of activating things, and could be any other things that you want to do, or you want to design a better health systems. You can do that. So idea of the feedback is important. That will give you the simulations going on and processes continuously. If you do this process on each step of time, then you get your simulation over time, or dynamic systems over time. Dynamic is over time. Okay, so I want to, in the next few slides, I want to show you how these steps are working, and is a time slice, if you like, how it works. With the simple example of the birth increases, population increases, number of the births will increase. So it's a positive feedback loop, and that looks like a population increasing, and so you have a positive effect, and so on. So you can. So the dotted line means that they will give that information back to the birth, and then the system will continue. And it makes it slightly more complicated, not complicated, but it's a bit more true to reality. And here you got the birth, you have the children, there's a delay. There's a delay between these, and this delay creates some balancing act. And then you get a negative feedback, which create a balancing loop, if you like. And so the systems is not purely going to increase very dramatically. You have some sort of a slow reductions in there. So how does these things work? So you have you can have so just if I go back, so you have this state as now, we call it. So if this number of the children now at the time 0, so if my time unit of time with the systems dynamics, with any systems, dimensionality and the unit of the dimensions are essential. So if you're talking about children's, we need to talk, you can't, later on go, this children doesn't become Apple. So they're still children's or adults, it's a human. So, and also the time units. So there's, if we're talking about the time, we want to know the time slice of T1. This T1 could be 2 months, sorry, T1. Could be 1 month, 1 year, 2 years, or whatever it is. We can study my time slice, you create the time slice. That's your, in mathematics, you could call the difference, or delta T. So what you're doing is saying, okay, what are the differences between number of the children's from time one, and at time 0 and time 1. So what are the differences? So if I wasn't cynical, I would say this is the variance, yeah, the change over time. So we want to know what happened in let's say my time slice, in this case 1 year. So T1, and then we have T2 and T3 and so on. So to do that, I could do the simulation like this. So here is the delta T, which is my time slice, 1 year. So you have K is my present, J is my past, and L is the future. Sorry about this. And so now if I want to simulate for one time slice, so one is step, if you like. So step n plus 1, and then my now become past, my previous now, which was K, here we go. If you look at the previous one, so it become past, and then now I've got a new now. Oh my. New now, which is K, and then new future. And then I'll continue doing this, and then I will have, at each time, there's a shift. Next time, that will be J, and then you have a K here, and then you have a new L, and that's an N+2. So that's how your really simulation is working. It's your time is sliced, and you're going to count the number of the population, for example, in this case, at, if you started with thousands, at each step, which is one at a time, 1 year at a time, let's say, or and then you can calculate your population, and then you say, okay, simulate for 10 years, simulate for 1 year, 20 years, and so on, and then you can calculate the populations and over time. But that's how the system dynamics works. And as I said before, behind it is all about integrations of these things and differential equations, which is in this. This case really is quite a simple model in these flows. I wish I could. I probably try to show you that how does it work within the software, these things. And here is another problem, and different to this health system, a causal loop for building constructions and so on. And this is, I think, is done in Stella. So you have again, you have one compartment with one stock with two rates. You probably noticed that the rates are not going into each other, so you have to have a stock, because the decision have to change the stocks, otherwise things doesn't work. Okay, so again, these are sets of equations for various things. So that's how if you apply, you don't need to do any of these any of these things at all when you're using the actual software. All you need to do is to model it, to know your parameters in terms of what are stocks, what is rate, and so on. So I'm sure in your head now if you have a problem, if you have some problem in your head, that you can identify. Even you went to the coffee shop and back, and I'm sure you identify some stock and some rate, but on your observation on the daily. So now I'm going to quickly show you some applications of the modeling for the next 45 minutes. So infectious diseases is a #1 killer of the human being in the world, and chronic diseases is the same. Inability, or #2 probably, inability of the healthcare professional to treat an infections in the first 24 hours of presentation had a significant attendant mortality. So the use of so in our healthcare, most of people use what they call empiric therapy, that to give them some time until they get the result, because when they see the patient, they don't have the result of the culture and so on very quickly. So what they do is do some empiric therapy to buy them some time. The empiric therapy is giving them some antibiotics in the first various type of in fact many type of antibiotics, because they don't know what is a disease to deal with it. But infectious diseases could rapidly grow very quickly, and so idea of the in this case, sorry. So if you have it's a basic model of susceptible, infected, and recovery. So this is a generalized model that lots of people use, with the added parameter attached to it. So I'm just gonna show you some of the basis of these infectious models. So in fact, these are very simplified versions of the model, and then you can see if these are the people, and originally they get infected, the populations are infected, it grows, and eventually they recover and steady down in terms of the infection and so on. And the rate of infection will go down. It originally is high, and then as the time goes by, it goes down. And okay, so we start with actually the basic model of infection. This is coming. These models are coming from Stearman. Over here, in Stearman book of system dynamics. So we have the susceptible populations, and this is the simplest form, and then we have infectious populations. And then we have a rate of infection, which is dependent on contact rate, total population, and infectivity of the disease. So we've seen this in the COVID in many ways. But here, there are some assumptions with the SI type model. But here, just let's say we increase this model to a little bit of and also we can model recovery of the population as well. But so in this sort of SIR model, so susceptible, infectious, and recovered. There are lots of assumptions that populations are homogeneous, and contact rate are constant, and so on, or infectivity, is in COVID. I think it was they were trying to keep the rate of or R level, if you like, but it's not quite R, but to bring it down, one person only infect half, or one other is not more than that. But with contact, and the idea of the contact rate is very important, because that was one of the decisions that they should have made earlier on, and they didn't. So because they didn't know the rate of infections and how the virus is spread. So this model that you see is very simplified versions of the infectious model, and that people use, but they cut. So you can see the. Apologize for this, because my it seems to me every time I touch the mouse, the damn thing changes. So you can see here you got from susceptible populations, you have some sort of a balancing depletions from this when they get infected. So it lowers down some sort of a balancing effect, but again, the infectious population becomes increasing, so it's reinforcing in this case. And then when they start recovering, then there's again the curves. So it's not going to go down, go up, down all the time. These two balancing loop is bringing the population to the level of that eventually they will recover. But here, then I think I may have a more complicated model here. So again, then you can add, the how, in terms of the reproducing rate of the infections is, you can make it more complicated, and because that's what in terms of the different diseases, you will have a different reproduction rate. So they all have a different way of affecting people. So that you have to model these things based on the data that you get. So one of the reasons that the COVID is the data wasn't available in the beginning, a lot of guesswork. I think we went into to it, but even though with a sophisticated model, a lot of people, did get it right. But even though it's slightly later, but the government did not move as quickly, as swiftly as they should have done to bring these things in control. So, you heard of herd community is just you infect everybody, but in this case, because it was such an unknown infections, and then it would have been quite a scary things to do if you cannot manage those vulnerable people. That's what happens in Sweden, for example, and they decided the policy. So again, this type of model, as I emphasize, most of the model are wrong, but some useful. You can some test some ideas and get some understanding of behavior of the system, and then make a policy decisions. That is really a most useful side of the systems dynamic model. I've just got my things here just to make sure I've said everything I want to say. So SI model captures the basic process of infection. It contains many simplifying and restricted assumptions. The model does not represent birth, death, or migrations, but in this case, we have now included the migrations into the equations. Okay, you can do more. And there's this paper, Journal of Clinical Virology, volume 128. The people played a different model, a generalized, susceptible, exposed, infected recovery compartmental model using factors specified to COVID-19 to investigate COVID-19 pandemic in the US. It is composed of 8 compartments: susceptible, unsusceptible, exposed, infected, hospitalized, and critical, dead, and recovered. So this compartmental modeling is slightly different, but again, it looks like the same type of bucket, but the way the rate goes is slightly different to that. That's a basic differential equation systems, again, that you use in compartmental modeling. And they produce, you can see when the cases rises, then the death rate is also rises. And you see this confidence between those two. The blue is the actual model result, and then the dotted line is 95% confidence intervals with the 2% errors. And it seems you can see that the confidence is widening up when the prediction is going away going further and further. Okay. So if you go to I can't, but let's see whether I can. It doesn't work out for me. So there are some simulator of COVID-19 so that you can ask question, what if, and have a deeper understanding of the epidemic. If you have this slides in front of you, but I think if you go to the this is it's run by Stella. This system Stella, not Stella McCartney. Stella is a software system, and the company is ISEE Systems. And if you go to their website and then you can get COVID simulator, and then it's like a flight simulator. You can play with it and ask questions. And so my system doesn't work. And another one is a runsim.com. If you go to this website as well, if you copy and paste it, I could do the copy and paste. If you click that URL, you get to this, and here in this case, you can just play this tutorials and run you through a system dynamic model of COVID-19 and how it simulates it, and what sort of variable they included, and so on and so forth. And you can see that they use SIR model in this case. I could leave that one, and then I'll go back to my slide because of the time. If you want to finish, and then the damn thing goes back in there. Sorry about this. And you're teaching, all this knowledge will go away. Oh, the IT, oops. Okay, so that's where I was. So you can see that the infectious diseases, and even though we had so much experience over time, is still unsolved problem, because each infectious disease bring a different type of variable into the systems, whether to be the infectious rate, or how the transmissions will go between these things. And you can see now, for example, in terms of the monkeypox, and because we have some immunity from various other injection, as Elizabeth was saying earlier on to me, the rate, and also the way this infection goes is through only human body contact, and so on and so forth. It's not airborne anymore. So the rate of infection is far lower. It's been around for a long time, but it hasn't come to Europe as often. Maybe this new variant has got more is slightly stronger in terms of infections. So from a infectious diseases, and I want to go back to chronic diseases, and chronic disease is another killer of the human. So you can see the number of the chronic diseases from 1990 to 2020 has increased enormously, nearly doubled. Not quite, but it's quite close. And so it's still on increase. That I haven't seen any report that prevalence is going down. Maybe in some countries going down. For example, Finland, it seems to be doing, in terms of cardiovascular diseases, they've been doing the last 30 years far better than, last 35 years, far better than any other countries, because of the rapid intervention they did earlier on in the health system. But in US and in the Middle East, in many other countries, because of the diet and behaviors and so on and so forth, and environmental factors, and also in terms of genetics, that these are increasing. So idea of how to deal with these things, some of the idea was earlier on in terms of create a model of assistive home care, telecare, or and home care approach to manage this type of chronic diseases like COPD and others. But its idea is creating technology and models to manage the chronic diseases. Systems dynamics is been applied to chronic diseases like diabetes and quite often. But here is one paper that has done a systematic review. This is, I think, CDC papers, and that the application of system dynamic model in chronic diseases prevention, a systematic review they've done, so the they show the disease onset and terms of people with the disease. And again, in this case, just wanted to show the number of the people in the disease who are diseased in the chronic diseases. So I just want it, I think it's coming, that paper's idea of showing you this is saying that, you know, onset of the disease, people with the disease, and outside. So you got one compartmental model and many auxiliary variables and constants within affecting all these rates and how the rate changes. Again, if you see in system dynamics, if you see this cloud, because you have to start a model from somewhere and then end it from somewhere. So you're coming from the source and then you sync it somewhere else. That's what the cloud means. So again, another model of system dynamic model applied to the chronic diseases is this safer and healthier people, vulnerable people, and affected with the complications and so on. And so you can you can model for elderlies and the various things, and you can do. In fact, system dynamic applied to the telecare systems as well, and show the effect of the telecare in terms of the how much saving you can do. And then you can simulate it and then see the patterns of your variable, the way the variable are changing over time, and see whether you can make some policy decision to change this, to bring the, for example, people who are reduce the number of the complications if you want to, and so on. And so that's one of the things, is that how do we reduce the people with the number of the complications. So again, the modeling of glucose insulin system dynamics in diabetics. I think this is done in the pigs rather than the human. There's some study done in here, and it's lots of modeling been done in diabetics, but mostly using compartmental modeling, because they're using quite a lot of physiology as well as some softer variables. Understanding the diabetes population dynamics through simulation model, and these are the people, Homers and others, and we can see. So what you can see from the title, you wanted to see how the diabetes population dynamics through simulation. They're doing some experimentation. Simulation is about, asking questions, what and if type of questions. So experiment in terms of, if you increase educations, would that affect the number of people, becoming diabetics and so on. And that's the simplest way of putting it. If you can see what I said, education, you see for access to preventative health care, screening of high risk. If you do this screening, would that help? So you can experiment with these type of things. So system dynamic could be considered as a lab for you, and laboratory, and then you test this idea. So I advise, in fact, it's quite so soft that you can do, because especially people who do as more qualitative data, and they can also utilize this and in terms of visualizations to show how these things work. And then, okay, and And then you can also show in terms of graph and the behavior of the systems and how things work. This is another papers in terms, oopsie daisy, about the role of system dynamic simulation modeling in terms of prevalence in the United States. And so here, so you can see from 1980, number of the people with the diagnosed diabetes per 1,000, and look at the increase it is quite significant. And from 2005 they were predicting what would be the state of the number of people would be. So the objective was to keep it in that level in 2010. But so this is the data they have. So they can now create the model to see through the simulation whether they can experiment with these things. Population without disease, undiagnosed prevalence, and diagnosed prevalence. So, and then here's the recovery. Again, this is quite a generalized model, so the description of the model. This has come from that paper I showed here. So if you want to know, this is just taken from that paper. So I will read it to you. Or model above is Stockholm flow diagram describing the incidence, diagnosis, and prevalence of a disease in a population. It includes 3 mutually exclusive population stocks, as well as related rates of change among them. The first stock labeled population without disease as a single outflow for the rate of the people developing disease or initial onset, which in turn is the only inflow into the stock of undiagnosed prevalence. Excuse me. Undiagnosed prevalence has a single outflow rate for diagnosed onset, leading to a final stock of diagnosed prevalence. There are 2 outflow from the diagnosed prevalence, one for the death and another for recovery, which returns people back to the population without the disease. So you can see that. So there's the arrow here, and the arrow here going this way. So. Okay, so this is so that's again is a reasonable things to do to play with this type of things with it, but they have to have the sources of the data. If you look at the paper, they tell you what sort, where did they get the data from, and what data they So data is important, and again I'm going to come back to the model. It is not perfect, is just is useful. So and again, assistant. I think some countries in Scandinavia had a very high level of cardiovascular diseases in early years, and they reversed it. So here, that's what these people were trying to do, is saying, okay, what sort of interventions do we need to bring this down and to a level, acceptable levels? Again, they used, by the way, you can, the Venn sim, all of you, those of you interested, is here, this one is a Harvard University's system, is run by Ventana system. You can download this free. and use it. There are very basic idea of a manual for you as well if you're using an Apple base or IBM type of systems. So that's so these people use that this type of this software to do the and this paper also is learning from evidence in the complex world is by Stearman and a quite extensive review and in terms of policy analysis in public health. We did a project in Victoria about using system dynamic and remote monitoring services for cardiovascular implantable electronic devices by Lisa Long and myself and Alex and Karen. And again, in this case, we had a number of the patient volume at 3 stocks, and then we had the 4 stock in a cardiac services. We wanted to see how we can manage the resources, best way to manage resources and give the patients and because this is a telecare system, so because they come to the center for every 6 months and so on, how to manage the whole of the process of the cardiovascular, this type of system. And then we have we created a system dynamic model for it and did some simulations and send the result to the people, and they had some decision to make and changes to make in that. So I think this is towards the ends. The system dynamic uses computer simulation model to reveal how known structure and policies often produce unexpected and troublesome behavior. I think I was saying this earlier on that you may think the systems doing this is you expect this type of an increase of outcome or oscillatory outcome, but when you run it, you can see is behaving slightly differently. So because of the interconnected connection of all the variables or non-linearity sometimes that create these things, or unexpected events could create these things. The computer model are constructed from descriptive information that usually or is already known. Such information relates to who is striving to do what and what individual will do under a variety of pressures. Human is involved in these type of models. The same approach carries over the non-human systems in nature and physical change. System dynamic model has been applied to mathematics, physics, social studies, history and economics, and biology and literature. Complex systems behave in a way entirely different from our expectation derived from experience with the simple system. Because intuition is based on a simple system, people are misled when making decisions about complex system, and you all know that inflation is rising in all around the world. This is a good example. I mean, if I don't know, in UK, everybody's going to strike because governments say that, for example, we're not going to increase the wages because if you increase the wages, inflation will go up. You would have thought if they increase the wages, inflation will go down. No, but it will go up because the people, if they increase the wages, the people have the capacity to buy more. And when they buy more, there'll be less goods around. But then if the less goods around, the prices will go up and then the inflation is going. So there is a vicious cycle there of the. So that's the government policy, most of the Western government policies. So the purpose of the simulation is to examine the behavior of a system's variable, to validate the model of the system behavior, to perform sensitivity analysis. Again, something I didn't mention about sensitivity analysis. Every model you develop, whether qualitative model or quantitative model, you want to know the extent that you can change the model such that the structure wouldn't change, output wouldn't change that much. So you would know the percentage of the changes. So to design alternative system structure and control strategy to optimize the behavior of identified systems variable. So identify the ST problem first, the process, develop hypotheses, test policy, and improve mental model. So since I was thinking system modeling, so this is a very good paper. Those people who are doing machine learning, modeling, and so on and so forth. So this is truly system thinking and bringing all the data together in terms of basic science discovery, molecular characteristic, mechanistic studies, a genetic, electronic health record, clinical discoveries, mobile health, and so on. All the information, all the signs and symptoms, genome, epigenome, micro, patient data, individual patients, and so on, putting them together and doing the analysis. And that seems to be the bringing all the knowledge, everything, the whole of these things, rather than individual, because we are working on it. If you're just working on an individual patient EMR data, you won't get far in terms of, depending on purpose that you have to do. So this is a good paper, good actually, a sort of summary papers of the various new knowledge, new methodologies used in health informatics. So for you, I've got a little problem. This is called Lorentzian equations, and that's if you implement this if you download the systems that I told you went in, and then if you compute these, you got about 3 compartment X, Y, Z, and then you've got various parameters given to you, and if you start with these parameters and then run the simulation, you will get quite a nice pattern coming up. So that is for you before you go to bed tonight. I will test you with this one when I come back later. Joking. So thank you for listening, and if you have any questions, I'm happy to answer.